Welcome to Webinar Wednesday. We are excited to have Accruent sponsor today's presentation, which is eligible for 1 CE credit from the ACI. At the conclusion of this webinar, you will be able to access a link that will take you to a quick survey. You will be able to download your certificate once you submit the survey. Before we begin today's webinar, I'd like to remind everyone that the second of our HTM mixers takes place October 1st and 2nd at the Hyatt Regency in Milwaukee, Wisconsin. This event is supported by the Wisconsin Biomedical Association. Join us for 2 days of networking, continuing education, and vendor engagement in a slightly modified, less crowded, and safer environment. Visit htmmixer.com for more information and to register for this event. Webinar Wednesday would like to thank our sponsor, Accruent. Today's webinar will focus on capital planning in a time with limited capital funding and Accruent data insights. The webinar will touch on current healthcare trends, healthcare financial state, top healthcare initiatives, review of capital lifespan ecosystem, importance of data integrity, sample capital planning model, replacing aging medical equipment, balancing risk in capital planning, and Accruent's survival curve. For more information, visit accruent.com. Our presenters today are Al Gresh, Vice President of Healthcare Strategy at Accruent, and Eric Fisher, Senior Product Manager at Accruent. Al and Eric, when you're ready, you may begin.
Well, hello and welcome everyone to today's Tech Nation webinar from sponsor Accruent. Today's session will focus on capital planning in a time with limited funding and Accruent data insights. Today's session is eligible for 1 CEU credit from the ACI. And now I would like to introduce today's speakers, Al Gresh and Eric Fisher. Al is the Vice President of Healthcare Strategy at Accruent and has held executive leadership roles at AlphaSource, TriMedics, and Alexian Brothers Health System. He led one of the nation's premier clinical engineering programs at Aurora Healthcare in Milwaukee. Al has also been the chair of AMI's Healthcare Technology Leadership Committee and recently authored the 2019 Healthcare Technology Management Manual for AMI. Eric Fisher. Eric is the Senior Product Manager for Accruent Data Insights and has been with Accruent for over 4 years. He and his team developed Accruent Data Insights from the ground up. After attaining his MBA from the University of Minnesota and observing the trends toward more accessible big data capabilities, Eric developed a keen interest and ability in applying advanced data science tactics to real-world problems. Over the past year, Eric and his team have used several of these newly packaged data science capabilities, primarily focusing on the quickly maturing field of natural language processing. And with that, I'm happy to turn it over to Al.
Thank you, Kelly. I appreciate the intro. Today we're going to talk about current healthcare trends as it relates to both financial and operational issues. We'll be talking about the healthcare financial state, which I think everybody understands is not real good right now. In the midst of COVID, we'll be looking at top healthcare initiatives based on a survey that we had completed with our client base. We'll be reviewing the capital lifecycle ecosystem. I think it's important to understand everything that feeds into that. And then we'll be talking about the importance of data integrity, because certainly that's related to all of what we're talking about today. I will run through a sample capital planning model, what's important relative to setting that up. We'll be transitioning then to my friend Eric Fisher, who will talk about replacing aging medical equipment, balancing the risk in capital planning. He'll be talking about Accruent survival curve and how to use the Accruent Data Insights My Institution feature. So let's jump in and get started. We'll start talking about cost pressures, and I'll go into a little bit more detail on that. But clearly, with most hospitals operating at about 60% of their normal income and patient volumes, clearly that's an issue today. We've seen declining available human resources. In 24/7's annual salary survey, you can see year over year that the average age of technicians at all levels continues to rise, and it's because the number of folks that are aging and retiring in the industry, there aren't the same number of folks coming in, younger folks coming in to backfill those positions. That's continuing to be an issue. It isn't specific to the healthcare realm, it's all industries that are affected by that. The survey results that I'll share, the top 5 areas of focus are asset management, alternative equipment maintenance, cybersecurity, capital planning, reporting, and analytics. The asset management and capital planning are very closely related, so that's one of the reasons it's important for us to be talking about what we're covering today. Back to the issue of cost pressures. Pre-COVID, the average operating margins of not-for-profit hospitals in the U.S., based on Moody's Investor Service Analysis, also cited in Becker's Hospital CFO report in August of 2018, reported an all-time low of 1.6%. If you think about this in terms of what it would take at 2% operating margin to meet the same, let's say you saved $1 million in bottom line savings, you would need to generate $50 million in new revenue to achieve that same financial bottom line impact. Also, 30% at that time were experiencing negative operating margins. Certainly that number is much higher today. An April 2019 update in Modern Healthcare, through all of the efforts that had been initiated in healthcare, things like mergers and acquisitions, steady patient volumes, revenue cycle improvements, cost-cutting initiatives, productivity boosts, and the shift to lower cost settings, all of that work translated in 0.1% increase in operating margin. And it's generally agreed that 2.5% is a sustainable operating margin. So let's look at what exists today in the midst of this pandemic. According to Kaufman Hall's July 2020 report entitled The Effect of COVID-19 on Hospital Financial Health, the pandemic's reduced the average U.S. hospital operating margins from 1.7 to -3 during Q2 of 2020. If you recall, I stated that 30% had negative operating margins. That number is much, much higher today. And consider this, things would have been much worse without federal government financial assistance. Also, 76% of hospitals indicate that they lack the resources for effective financial planning and analysis. So what I'm hoping we can help with today is that piece of it, is to help provide the resources for effective financial planning and analysis. So I mentioned earlier the survey that we had done with our client base, asking what the top healthcare initiatives were. And in the HTM or clinical engineering space, 75% reported asset management as their first priority. If you look at facilities engineering or HFM, 79% reported asset management as their first or second priority. Other top initiatives in HTM, AEM was up there at 40%, work order customization was a second or third, and then cybersecurity at 35% was first, second, or third priority. And then back to HFM, 41%. Work order customization was second or first or second priority. 37% report compliance reporting as first or second, and then 65% report capital planning as third, fourth, or fifth priority. So it's still up there in the top 5 as far as initiatives. So let's walk through the capital lifecycle ecosystem, and you'll see here the 6 major components of capital lifecycle, which is the pre-acquisition or the capital planning part itself, and then the technology assessment piece of it. So we made a decision about what we need, okay, and then what do we replace it with? So what's the right technology to replace it with? And then you move into the acquisition phase where you actually, after you've decided what to get, you go ahead and acquire that thing. And then the next phase is the installation. And once it's installed, you start your support life cycle, which most CMMS products operate entirely in that space, where you do your performance management. And then at the end of the capital equipment life cycle is the disposition. For each of these, I included both the data sources to help make decisions in each of those different bubbles, as well as the support entities that are there to help with that. So, for instance, capital planning, certainly your data sources, one of the key ones is your CMMS. You've got your age information captured, service costs versus purchase costs, number of service events, supportability. So, is this thing being end-of-lifed by the OEM? And if it is, can I still get parts for it? Other sources, department requests, and leasing information. And then the support entities in the capital planning space, you've got companies like Ateneo, who's a very strong partner of ours, Strata, ECRI, GE, Philips, as OEMs, third-party service vendors, can provide support there. Kaufman Hall is a financial planning system. HFS and Mitchell are project planning companies that help with that. And of course, your GPO, whether it's Vizient or Premier or some other, can help you with that using the MEM data that they have in their systems. Similarly with tech assessment, your CMMS is a strong source of data for that component of it, equipment history and total cost of ownership data. Support, some of the support entities, class, where they do ratings on equipment and both reliability and technology assessment. SG2, which is a company that I worked with in the past, now owned by Vizient. Certainly Equity if you're a member of Select Plus. And then your GPO with the MEM data is another good support entity. And then throughout the acquisition, and I won't go through each and every one of these, but you can see the complexity that exists throughout each part of the capital life cycle and the support systems that are available. If you look at the data sources just around this circle of life, if you will, you see that many of them contain CMMS data as a data source. I really want to hold that up as a way to stress how important that is in making good capital planning decisions. So here we are, data integrity. So this is key. If you've attended any of my webinar sessions, I always talk about the maturity curve in both HTM and HFM in trying to get to a better state, moving from a cost center, necessary evil, and maintenance and repair focused, and being reactive and firefighting and point solution focused. You'll see that step one in moving up that curve is, and the foundation is, data structure and data integrity. And without that, you're not going to be too successful doing centralization and standardization, developing key performance indicators, increasing your visibility and accountability, and increasing customer satisfaction. If you base everything on a strong foundation of data structure and data integrity, that's going to help you get to that future state of being a customer-focused service business and being recognized as a valuable part of the organization, being predictive and proactive instead of reactive, and doing total life cycle management. Senior leadership that I've spoken to, that's what they're looking for. They want someone who can help them do that total life cycle management and do it well. What I show here is the first page of a data and security integrity policy. This is a very, very long policy, and I'm not going to walk through it here. I've covered it in other sessions, and I will certainly make this available. The gist of it is this first policy statement. It expresses that the purpose is to ensure that all data housed in the database is complete, accurate, and consistent with established format and nomenclature standards, and is entered in a timely manner. The other thing that I want to call out here is the last statement under the policy where it says, failure to comply with these processes will result in progressive disciplinary action up to and including termination. So you are making a very strong statement to your team that you are setting the expectation that you will have good data integrity and you're not going to accept anything less than that. And once you get into the actual policy itself, it goes through things like security settings and worker statuses and work centers, codes, facilities, accounts, sources, device categories, models, assets, schedules, materials, procedures, security, work orders, and for each of them provides definitions, data formats, functions, and processes, and anything else that's relevant to that field that would maintain a good data integrity. If you don't have a data integrity policy in place, I strongly suggest you implement one as soon as possible. And like I said, I'm happy to make that available and we'll actually provide it as a resource, an additional resource to this webinar. What you're looking at now is a sample capital planning tool, and this is something that I worked extensively on in a couple of organizations that I worked in. And essentially what it does is it takes a group of criteria and creates a scoring matrix to help you understand what equipment should be considered for capital replacement. And so you see in here that equipment age is one of the factors relative to AHA, estimated useful life, service costs versus purchase costs, number of service events versus what's normal for that equipment type or device category, service support capabilities, and this next slide shows what the sample assessment factors are. Looking at the age factor, you get one score for 0 to 65% of AHA estimated useful life, another score for 65 to 150, higher score for 150% or higher. And one of the things that I always stress when you're putting something like this together, I strongly suggest that you meet with your CFO, your COO, to present and sell the program concept, but then come to agreement on the scoring and weighting before you ever provide an end report. The questions that I asked them when I presented it was, first of all, do we have enough available capital to satisfy all the requests? We all already know the answer to that. That's, even before COVID, that was never the case. And then ask the question, would it be beneficial to have a tool that uses objective criteria to determine which devices should be considered for replacement? I'd be hard-pressed to think of any CFO or COO that wouldn't answer yes to that. Remember what I said about data integrity? I would ask, do you have 100% of acquisition date fields complete in your database? And if you don't, how can you calculate the age factor? Do you have 100% of your purchase price captured in your database? And if not, then how can you calculate service costs versus purchase costs? Do you have a high level of confidence that all of your service activities are being captured, whether they're performed by in-house or third party? Are they being captured and entered accurately and consistently in your database? And if not, then how are you going to be able to accurately convey what your service costs are or the number of service events? So you can see how all of these things reflect the importance of good data integrity. Let's talk about lease history. And in this spreadsheet, we did include lease information. Up until very recently, and probably up until this year, healthcare organizations weren't doing as much leasing. Back when I was doing this on the hospital side, we were doing a lot more leasing because you had the ability to move your lease costs into your operational expense versus your capital expense. And back around 2010 or so, GAAP, which is the organization that sets the rules around this. This is the generally accepted accounting practices, said that, capital is capital, and regardless of how you pay for it, you need to take those, whether it's leased or purchased, you need to take those dollars out of your capital bucket. So that advantage went away, and so many organizations stopped doing leasing as much or stopped doing it altogether. And the only reason that people were leasing was if they were cash strapped. Well, I would ask the question, who isn't cash strapped today? And I would expect that leasing is going to become much more prevalent again as a result. How that process typically works is you'll lease a piece of equipment. You'll typically sign up for a 5-year or 60-month lease, and then everyone forgets about it. And you come to the end of that term, and you have to do something, but nobody's planned for it. You haven't made the assessment of whether or not what you leased is still a viable technology or piece of equipment, and if you want to keep it. And if that's true, then your opportunity should be to re-up for a new lease, but at a lower rate. And if you didn't plan for it, you have very little option because you didn't include it, the replacement of that device in your capital budget. If it isn't a viable piece of equipment anymore, or you want to opt for a newer technology, you haven't budgeted for it. You need to capture that information and plan for it here as well, because if you don't do that, what often happens is you just simply end up making month-to-month payments on that same original lease, which is literally flushing money because you're paying brand new equipment prices for 5-year-old equipment. Typically, if you re-up on a subsequent lease at a shorter term, your lease payments will be 40 to 50% less than what you were paying. So I'll ask the question, do you have a seat at the table? And which table am I talking about? Well, all of them. These are just examples of some of the committees and groups that met regularly and existed in the organizations that I worked in. There was the Capital Committee, the C team, there was the Nursing Strategy and Governance, and IT Strategy and Governance. And I was in every one of these groups. And I'll just say that by demonstrating the value that you can bring, the more likely it is that you'll be welcomed and even invited into these groups. So at this point, I'm going to pass the baton to my friend Eric Fisher. Eric?
Thank you, Al. Hi, everybody. I'm Eric Fisher. I'm the Senior Product Manager for Accruent Data Insights. And I'd just like to take a minute here to just kind of reiterate a little bit of what Al had mentioned. Obviously, healthcare providers are in a very tough spot. The fact that COVID-19 is minimizing the elective surgeries is making it difficult for healthcare providers to meet some of their financial expectations. Obviously, they're looking for ways to reduce costs while avoiding furloughs. Accruent Data Insights, one of the products here we developed at Accruent, can hopefully help enrich your data and make things a little bit easier. Oftentimes in the CMMS, which is kind of the central point of capital planning for medical equipment, is missing some data, or has duplicate data. So we've looked at that. It looks like about 67% of the CMMS models are missing a price or have an inaccurate price. And then about 25% of models tend to be duplicates of other models. Obviously, there are some institutions that are doing great. Even the great ones have some duplicate models and some missing data points. It can be a full-time job managing data integrity. Even if you've had a data integrity policy, things can happen through the course of a healthcare provider's organizational life that data tends to get a little bit dirty. So we can certainly help there. I'll also mention that we've spoken with some CFOs even recently talking about how they're losing money on a regular basis now, but it's really difficult for them to figure out how to turn things around, as oftentimes about 70% of the expenditures are tied up in fixed assets, things like the building, things like the medical equipment, things like the people that they don't want to lose. It really is difficult, and one of the CFOs that we had mentioned believed that managing medical equipment is financially going to be a hot spot in the next 5 years. So here's where Data Insights can be an integral part of this. If you're not familiar with Accruent Data Insights, we have taken and aggregated the data from a large number of healthcare providers. I think we're up to about 1,500 hospitals, taking that data, aggregating it, and coming up with some metrics that can help drive helpful improvements in managing medical equipment. We have 10,000 devices now that we've cleaned and can present. We have a lot of different attributes of those 10,000 devices. We created an age of technology data attribute. It aligns to one of the items on Al's presentation earlier. You want to know which technology is obsolete, emerging, etc. We also have data on the reliability of each device, which can certainly be helpful in determining if you want to keep it around or not. We have the improved life expectancy by device model. So that's the survival curve, and I'll show you that a little bit more later. We also have acquisition price by device. And then we have another number of things that help you manage the device in general, things like labor cost, parts cost, total cost of ownership, etc. So a lot of different things, and I'll show some of those just so you can get an idea of what we've done with our data and how it can help you. Just to spend a little bit of time helping you understand the scope of things, we went through this large effort. It's been over a year of us getting to this point where we've taken all the data that we have and created this catalog. And the journey to 10,000 devices was kind of tricky in that every hospital is different. They have different procedures. They have different ways of referring to each device when they manually enter it in their CMMS. And so here's just an example of how complicated that can be. The Becton Dickinson Alaris 8100 is a very popular infusion pump, and it has over 100 different aliases. It could be referred to as the CareFusion Alaris 8100, the BD 8100. In some cases, they may procure that through a third party called Cardinal Health. All different ways of referring to the same device. It makes matching very tricky, but we have really sort of aced that capability here. We've developed it, and we're doing a great job in sort of perfecting that capability of taking another name of a device and matching it up with a standard name. So we've done that, and it can really help. And here's the concept of how we thought this could help the organizations out there manage their medical equipment, because it might be a mess in your CMMS. We can use that same sort of matching technology that we use to clean our data, and we can clean your data. On the left there is taking your asset inventory. In the middle is auto-matching it using our data warehouse. From there, you can enrich your data and use it to make any number of smart reports that help you make more intelligent decisions, whether that be for capital planning, for operations, or just for managing risk. So that was the concept that we had even before we started developing the My Institution tab. And then here's what the My Institution tab looks like. And I will do a demo and show that to you as well. But just kind of seeing it doesn't really tell you the full story. So I'm also going to use the iceberg analogy and just kind of explain that what you're seeing is really a lot more underneath. When you look at the My Institution tab, we've taken all of the device names that you have and we've deduplicated them. And even the best organizations have about at least a 10% number of models that are duplicates. We also have most organizations that aren't keeping the price data populated very well in their CMMS. And they don't have total cost of ownership. Or they have it, it's just not easy to gather. The life expectancy, we feel like our life expectancy data is a little bit more accurate than what you might find with AHA. The device age, in some cases, just the install dates can be really crazy or inaccurate. And we have ways of kind of mapping up to the work order data to help you even clean some of your install dates and ages. So you are getting kind of a capital plan that has, you know, really better data than what you might just rely on if you're kind of going to go straight from your CMMS. Especially if you're showing executive leadership, and if Al mentioned you have a seat at the table, you really do need to have your data in a good spot to ensure that it's up to quality when you're presenting it at the C-level. So now I'll go into the Accruent Data Insights solution and just give you a quick demo. So this is the Accruent Data Insights solution, and there are two different key components, the model lookup component and then the My Institution component. I'll show you both here. The model lookup component really lets you just select anything, whether it is a manufacturer that you want to look up. If I type in, Medtronic, I'll get a number of Medtronic devices. If I want to go look up category, I can do that. I'm interested in this Becton Dickinson infusion pump, for example. You get kind of this first page, shows you how many devices we have in our data set. This is really, like I said before, gathering from 1,500 different hospitals. Most people will have a large number, but not nearly the amount that we have. It really helps analyzing the full population so you can get the cleanest, most accurate data. So this is the model age that I was explaining earlier, which correlates to the age of the technology. And then the reliability tab shows how reliable the device is, and you can compare one versus another, and I'll show you that feature in a little while. You have the failure rate, the failures over time, as well as some things that help you manage the maintenance of the device. The Lifecycle tab, though, is the key thing that Al had mentioned earlier. This is the survival curve. We've taken a lot of time and effort to look at the whole population of models and determine when are the devices really going to install and then being retired, and how long does that take. So this is based on real data. We do use AHA data in here as well to inform the model a little bit. The curve is really a predictive curve. You can kind of choose where your organization is on that curve. Are you kind of replacing things where everybody else replaces things? So in this case, that would be at around the 10-year mark. Or are you maintaining that equipment a little bit longer? And we kind of feel like in this current climate, right, with the financial crunch, that organizations are going to be a little bit more at the long tail of the curve, where they're keeping the equipment a little bit longer, but it kind of gives you some idea how long you can and should keep that equipment for. And then the asset price gives you an idea of what it would cost to replace it. So that is also useful in capital planning. Kind of some general helpful views to manage your equipment. You have the labor and the materials tab that rolls up to your total cost of ownership, which is then reported, and then you can compare all these metrics that were on those previous drill down tabs, so you can kind of make the best decision on when you do have to replace something, what should you replace it with. And then generally for our customers who want to know, like, how are they maintaining the device compared to the industry, you can look at the benchmarks tab and see if you're maintaining it well, or possibly some process improvements. The security tab gives you any known CERT vulnerabilities. So in this case, there is one from the US CERT website that says that this device has a potential vulnerability. And then the forum tab is kind of an open spot for the biomed community to collaborate on posting comments about their experiences managing that device. The whole point of, I think, looking at this model lookup feature is so you get some understanding of how much information we have and how deep that information is for each model. But the magic sort of happens here in the My Institution tab, where you can apply the knowledge and intelligence of that model and apply it to your inventory. And that's what this capital planning report does. Going back to that iceberg analogy, what you're seeing here is just the tip of the iceberg. What's underneath this report is all the work that we've done to clean the data. You're not going to see any duplicate models here. You're going to have a good category. You'll see the device age, which also has a level of cleaning to it as well, especially if there's any outliers where, for example, let's say you had a work order that was before the install date. We take all that into account. We bucket things together into this age bucket. So you have 25 items that are 9 years old of this particular model. So it really collapses this whole report, makes it much more presentable to your C-level team. And then we look at the data from that survival curve. So here is the median life, and that's the 50% point. And then we base an estimated remaining life off of that. And then we also have the max life. So this is the 90th percentile of that curve. So this is where we're thinking some healthcare providers are going to be given the financial crunch. You want to extend the life as much as you can. Here's the age of the technology or the age of the model. This is a mature model. So the three categories we have are emerging, mainstream, or mature. And then we have the replacement year. This is our best estimate of when you should replace that device. And then we have the replacement cost. So this is the price associated with what most people had paid for it. And then you get your total line item. And so it really aggregates things at a nice level for finance. It takes a lot of the detailed data from biomed, and it gives you the data points that you need to improve prioritization, especially now when limited capital is available. So you can do a lot of things here in this report. You can sort by your highest cost items, for example, and then you could look and say, okay, I want to know what's coming up in 2021. A lot of different things you can do with it to slice and dice and figure out what you should be budgeting for. That's the main thing that I wanted to show with the My Institution tab. There's a number of other reports that I won't go into detail about, but I'll just show briefly. The AEM opportunities is another thing that can help you financially improve your operations. You can look at quickly across your whole inventory which models are best suited for an AEM from a financial standpoint. There's a lot of work to do yet to figure out, is this model going to qualify for an AEM, alternative equipment maintenance plan, or not? But at least it gives you that financial insight to tell you, what can I save from this model? And then the benchmarks tab, also another way to quickly look at all of your models and determine where is it best suited that I kind of change my operations a little bit. Then we have a security feature which shows you where are the security vulnerabilities for your inventory, and then a parts budget report which kind of gives an estimate of what you might expect in terms of parts replacements. So that's the demonstration of Accruent Data Insights. So to recap what we saw in the Accruent Data Insights demo is that we start with your data. Your data may have duplicate models, gaps or holes, or limited attributes. Then we clean the data using an auto match and we fill in the gaps. Then we use that data to create smart reports like the Smart Capital Planning report, which uses all the advanced data attributes to make better decisions. So what drives the decision to replace devices? Well, we did a survey, and it turns out that even before COVID, 90% of the survey respondents basically said that they replace it when they fail. But now, even with more of a financial crunch, prioritization is going to be even more extreme. But it's really important not to get into the mindset of waiting until there's a broken piece of equipment or a crisis and getting into the emergency fix-it mode. Ultimately, lots of factors go into the decision to replace. Our data is not a silver bullet, and no one uses just one data source. But these decisions add up to big savings. So it is wise to use multiple sources to decide. We know this all goes ultimately into a human decision in the end, and oftentimes a group of people decide, but having the data sure helps. The decision isn't really done at any one point where you have a certain amount of data. There's this interaction, right, between clinicians and the CFO, and for any big capital plan, there's going to be a number of people who are going to come to the table And I just wanted to point out, I guess, with this slide is that there's a number of biases that occur. It is great that everybody gets together in a committee style, shares their experience, especially bringing biomed to the table to talk about their pains of maintaining something, or the physicians talking about how a device needs to be better to provide a better level of care. But it is important to mention the biases. So on the right, there's a number of psychological biases kind of taken from the academic world of psychology. And on the left is an example of how that bias might apply in the case of managing medical equipment. So the top one is kind of a common bias that people mention, which is that the physician knows best, or the physician is the one that's bringing in the revenue. They get to be the one to decide. Well, there's a little bit of a bias there, an authority bias. And then there's a number of others as well that have either a confirmation bias to it, an anchoring bias to it, where people assume, well, we've always done it this way, that's how we should do it. And then there's an in-group bias or kind of an egocentric bias, where you're in this group of elite committee members, and you kind of think, we know what we're all talking about, right? And so these biases tend to creep in. They don't result in horrible decisions, but they can result in suboptimal decisions. And so I think that's kind of why it's important to always bring in the data. Accruent Data Insights can help bring in that data, give a little bit of a additional perspective on things. So the next slide that I just wanted to mention here is we've looked across all of the hospitals that are participating in our data warehouse, and we took a look at how much can healthcare providers defer. And on average, this is looking at, on average, we calculated $5 million can be deferred in 2021. And that doesn't really tell the whole story, so I'll kind of explain a little bit more about what this is. This is if you were to take the AHA life expectancy, which is not very reliable, so a lot of people have multiplied that by 1.5 because hospitals have already been pushed to extend beyond what's recommended. And then so if you take that metric of 1.5 times AHA, and then you compare that to what Data Insights says for their maximum recommended life, which is 90% of the survival curve, you end up with a $5 million difference. So, we know hospitals are already deferring costs, but that's just an example of what could be saved, even though it's not exactly savings. It's really a deferral. And even at that point, the value is really taking $5 million possibly off the table and removing that from that difficult prioritization discussion, because that really is what is frustrating with the capital planning process, is not really knowing what the expected life should be. So just wanted to share what this calculation is and how it can help you. We certainly don't want to give the impression that deferring the replacement of devices is always the best decision. Financially right now, it's the one that healthcare providers are going to be leaning towards, but obviously there's a lot of risks with deferring life cycle or replacement. So an example of this is assuming that age always means that it's going to fail, or at a certain point it's 16 years old, that thing's going to fail. Well, that's not always true, right? So we have some data points to help you look at this. If somebody is also pushing for extending the life, but you notice, for example, here in this average parts cost for this device, at age 16 there's a big jump in parts cost. And so possibly that would be a good time in year 15 to replace it. Or perhaps some failures are going to creep up here. It looks like in year 8. And having that information can be really valuable in pushing back on somebody who's saying that we can defer further. It all comes to kind of making the right decision and having a harmonious balance. So we've heard the term sweat the equipment. We had a CFO that we spoke with who said that was the mantra within their institution, was to try to get the most out of the equipment. There's a flip side to that as well, that you have to be a little bit careful about. In an organization that I worked at, we had this little check for ourselves where we would ask ourselves, are we kicking the can down the road? Are we just putting off the inevitable that we really need to replace this thing? And if you start getting into that mentality where you're always kicking the can down the road, you end up in a pretty tough spot. You end up with a large number of devices that need to be replaced in a year, and that might not even be feasible to accomplish that. And then you just get stuck in this hole where your healthcare provider has just this mountain of aging equipment that it's going to be just difficult to get out of. So there's some pros and cons to retiring early, and then you got to be a little bit early. You got to be a little bit wary of retiring too early and wary of retiring too late. There's also a harmonious balance here between a surprise where somebody says, I need this, CT scanner now, and then the response being, well, put in your request until the next capital planning cycle, which in some cases for hospitals is every year. It might not be feasible to wait that long, but somehow hospitals have to be ready for things. And I think Accruent Data Insights helps with that as well. If you're really good and you have the information to plan and have these discussions and save time by not talking about some of these things that are not at the end of their life, you can come up with a good 5-year plan that reduces surprises and puts your plan in a good spot and giving yourself kind of a good view into the next several years. So, and finally, I just wanted to share with you what we're working on next. There's a couple of key areas. The first is converging more data sources. So we know we have a partnership with Atania, and they have some replacement model information that would be helpful in the capital planning process. They also have price data as well, so we can get kind of an even better pricing data source. They have list price as well as replacement costs. And then the end of service dates is something that we're continuing to try to capture from end of service letters. There's MDS2 and cybersecurity data, so you can understand, for example, the operating system and age of the operating system that a device is running on. And then patient safety data, which is really helpful. Of course, it would be great to know if a particular model has a large number of adverse events or recalls. So converging data is a major theme for us going forward. Another thing is trying to improve our workflows. So we currently have an integration with Atania, and we have a number of models that are linked up. However, there's an opportunity there to possibly add to Atania button to that capital planning report, and then you get the benefits of the whole Atania workflow. There's also a number of integration opportunities with Connective and improving workflows there. You could have some more intelligent not to exceed thresholds on part replacements. Lots of opportunities, and we're very excited about what the future holds. So with that said, I will hand it back off to Kelly, and thank you everybody for listening in.
Thanks, Eric. We are now coming to the end of today's session. If you have any questions, please contact us at sales@accruent.com, and we'll be certain to get back to you just as soon as we can. Several times through today's session, Al mentioned the 10 steps to make your HTM and HFM departments a strategic asset webinar series. This series is pre-approved for 1 ACI credit each session and is available on demand on our website. Go to accruent.com, healthcare, resources, webinars, and check out the series. The post-webinar certification is automated through TechNation and will be included in the follow-up emails coming to your inbox shortly. And with that, we will conclude today's webinar. Thank you very much for attending. Thank you, Al and Eric, for sharing your expertise. Look for the follow-up email coming to your inbox shortly. Thank you, and have a great rest of your day.
Thank you, Al and Eric. A quick reminder for our attendees today. To obtain your certificate for 1 CE credit from the ACI, please remember to click the link below this webinar title to complete today's survey. If you have any questions, you can reach us at webinars@mdpublishing.com.